Hi Kilian, so you had some surgery in the past, FUE and strip surgery, and you had some scars on the back of your donor area which you wanted to treat, and I recommended that you try scalp micropigmentation, which eventually you said you wanted to try. And what was your experience with that?
Well, I can pretty much do a much shorter haircut now, which is great, and I wanted a bit more density in the back, the appearance of it, just to camouflage the scars and allow me to, do a fade haircut, and I can do that now, which is really nice. So it's kind of like, in a way, that I've had a transplant within a couple of hours with immediate results. So it's great. I think we did it a month ago, and now I'm getting haircuts and there's no downtime, which is one of the big advantages.
So it just gives you more options with styling your hair.
Pretty much, yeah.
Okay, let's take a look. Just turn around for me there, please. So this is now how it looks at this time. So would you have worn your hair a little bit longer in the past now?
Yeah, I had to, and while, a few years ago I could wear it very short. As you do more surgeries, the trade-off gets, it increases. So now I'm back to, gosh, where I was, maybe in my early 20s.
So I'm just going to run the comb here, and it kind of just makes it more homogeneous, and yeah, it just creates a...
It's natural, which I really like. I was a bit apprehensive from the internet because it looks sometimes too dark and that's why I wanted to go with a surgeon who's experienced doing it. So I'm really pleased.
Yeah, I'm glad to hear that. So, one of the problems with scalp micropigmentation is that people overcook it, They try to do too much with it, and then you start getting too much ink, and it gets a bluish tint and things like that, So you have to be, and also the shade of grey that you select at the start, it works on a scale of 0 to 28, so, and you want to sort of also think about the future, where if everybody gets a little bit more grey hair as they get older, so the darker the hair is, the lower on that scale of 0 to 28. So it means that we dilute the ink less, the black ink, if the hair is darker, and the lighter it becomes the hair in color, the higher you go on that scale. So and then the other thing is that the immune surveillance cells, they eat away this ink. Obviously, they recognize it as foreign, but the fact that it gets slightly lighter over time, very slowly, also is beneficial if your hair goes grayer. So it's actually a very robust treatment.
I think it'll buy me a good decent bit of time and ultimately prevent more surgery soon, which is great.
Thank you very much.